Welcome to the HIPAA Security Awareness Training. There are 7 parts to this training session, beginning with an overview of the Health Insurance Portability and Accountability Act, or HIPAA. The HIPAA security rule requires organizations to take, quote, reasonable and appropriate, unquote, precautions against, quote, reasonably foreseeable, unquote, risks to the confidentiality, integrity, and availability of protected health information, or PHI. This brings up the question, what is protected health information? Essentially, protected health information, or PHI, is anything that can be used to identify an individual, from name to email address. The current list of PHI includes 18 items. As new forms of personally identifiable information evolve, it can be expected that this list of 18 items will grow. It is worth noting that both vehicle information and personal images are on the list of PHI. The next consideration is what is included in security awareness training. Security awareness training is designed to inform and train all employees in the limits of accessing and communicating personal information during the provision of health services. Access needs to be restricted to the absolute minimum of information needed to serve the needs of the patient. This will vary from case to case. Lack of effective training in security awareness can have serious consequences for the organization. UCLA Medical had information access restriction policies. However, employees were not trained in these policies and inappropriately accessed information on 2 patients for purposes of entertainment. The organization was fined $865,000 for this violation of patient privacy. Security awareness training is an important part of the overall HIPAA cycle of compliance. The HIPAA cycle of compliance shows the annual tasks required for an organization to achieve and maintain HIPAA security rule compliance. Typically, once a quarter, the organization will 1. Update the status of reviewable safeguards, such as AC1, access control, and AT3, key staff security training. 2. The organization will conduct a formal, semi-quantitative risk assessment. 3. Based on the results of the risk assessment, the organization will create a deficiency remediation plan that includes tasks, assignments, and scheduled completion dates. And 4. The organization will execute the remediation plan over the rest of the quarter. This process will be repeated quarterly as long as the organization continues to handle protected information. This security awareness program was not designed arbitrarily. It is closely based on the recommendations and protocols of the National Institutes for Standards and Technology, or NIST. The NIST has been assigned to define information security for all non-classified data in the federal system. The Office of Civil Rights, which audits HIPAA compliance, calls the NIST protocols the industry standard for protecting ePHI. The primary protocol for HIPAA information is NIST 800-66. This training program covers 23 of the 101 NIST 800-66 security controls, or safeguards. The remaining safeguards are covered in separate training programs for IT staff and for supervisors. Safeguards are grouped into families. 8 of the 17 families of safeguards are included in this security awareness training. The 8 families of safeguards included in this training are access control, security training, contingency planning, user identification, incident response, media protection, physical access, and system integrity. All associates handling protected information have a responsibility to protect that information. There are 23 security safeguards that need to be followed by associates under the NIST information security protocols. Failure to follow these precautions can result in unauthorized release of protected information and damage to patients. Security training for associates includes review of each of the 23 safeguards. The 23 safeguards are divided into 8 groups or families. Each group has a group definition, followed by a summary of the safeguard and recommendations on how to carry out the safeguard. Access is the ability to read, modify, and save protected information. Access control includes the specific safeguards to restrict access to authorized persons. AC1 is access control policy. This policy must be distributed to all associates with access to protected information. Current best practice is to use passwords with 12 characters or more that cannot be shared. AC17 is access control for remote access. Best practice is to allow remote access, if at all, only through secure channels like HTTPS or VPN. All remote access connections should pass through an IDS. The organization needs an access control policy for all portable and mobile devices, from phones to thumb drives. At a minimum, all mobile or portable devices should be encrypted. There should be no exceptions. A session lock protects a workstation from unsupervised access by freezing the display after a period of inactivity. Best practice is for the session to end after 15 minutes or less, and for the user to have to log back in to resume access to protected information. Remote sessions should meet the same criteria as local session locks. If a remote user is inactive for 15 minutes, his session should end and a full re-login be required for re-entry into the network. Security awareness involves being mindful of how unintended user actions can cause major problems. Human error is one of the 4 main causes of unauthorized release of protected information. Security awareness involves being mindful of how unintended user actions can cause major problems. Human error is one of the 4 main causes of unauthorized release of protected information. Security awareness training needs to be integrated with general information security training and policy, whether or not it is taught as a separate program. All computer users need security awareness training before they receive access to protected information. Training must be updated at least annually and whenever changes are made to the information system. Different data systems are subject to different threats. The security awareness training materials should be based on threats to the specific system, rules of use, and group security policies. There is a wide array of professional contacts and associations available in the information security universe. Security is a major topic in multiple industries, and good advice is plentiful. Monthly contacts with security support groups are recommended. A contingency plan is a prearranged strategy and procedure for dealing with a physical disaster. A flood is no time to be looking for the electrical shutoff. Contingency plans need to include roles for all associates, even if their task is to stand by. Associates are responsible for knowing their contact protocols and tasks in the event of an emergency. Contingency plans should include a simplified decision tree or equivalent with contact information for all key personnel. Training is a necessity for a contingency plan. This should include all personnel with access to PHI. Training should happen every year. There are computer programs which can realistically imitate an actual emergency. Contingency plan training is not a trivial task and may take a full day or even longer. Depending on turnover, it may be necessary to train subgroups such as communications managers or power system technicians more than once a year. Backups need to be done at both the user and system levels. Backups must be stored at a secure remote location. Do not store backups on top of the local server. Best practices involve securing backups off-site. One of the best and least expensive off-site backups is a safety deposit box. It is literally as safe as a bank. A good alternative is online backup, which allows incremental backups more than once per day. It is tempting to avoid the hassles of testing the information system recovery program. That failure to test can have tragic results. While modern backup systems are increasingly reliable, they can still have unexpected problems. Inability to restore a database can destroy a medical practice. For extra reliability, consider redundant systems. With a tremendous fall in the price of hardware, dual or quad servers can be cheap insurance. User identification and authentication separates the sheep from the goats, or the authorized users from the hackers. There should be no access without user authentication. Authentication can use passwords, tokens, biometrics, or a variety of combinations and methods. At a minimum, strong passwords are required. Biometrics are increasingly cost-effective and hard to defeat. Authentication of authorized devices as well as users adds a substantial extra layer of protection to system security. As with a disaster, a security incident is no time to figure out who to call and what their number is. All users need to know their task in a security event, even if it is only standing by. An incident response policy needs to be updated at least annually and given to all associates. The policy must state objectives, responsible parties, and assigned tasks. The 2013 HIPAA Omnibus Bill greatly expanded the breach response requirements, including public notification, patient notification, and law enforcement interaction. Like emergency response, incident response procedures require training at least annually. Maximum realism yields maximum training value. Every year, the incident response plan needs to be tested in as realistic a manner possible. All associates need to be briefed on the results of the tests. If at all possible, testing should be done on a day when patients are not present. Lost media such as thumb drives, laptops, backup tapes, etc. are a major source of PHI breaches. The organization needs to write a media protection policy that is given to all associates and is updated at least annually. Media protection strategies need to involve controlled access, ensured destruction, and strong encryption. Media access needs to be restricted to authorized users who have met all of the access control requirements. Unless guards are available for access control, the group will need to use automated security control systems. The access control devices need to record all access events for later audit. The pickup, receipt, transfer, and delivery of media must be restricted to authorized personnel only. This includes voicemail, which may pose special problems. Transport of unencrypted media should be avoided. Delivery should be hand-to-hand between authorized persons. Media should never be left for pickup. Numerous cases of unauthorized data loss have been traced to ineffectively destroyed or sanitized media, especially hard drives. Note that hard drives are now commonly found in copiers and printers, as well as workstations. Sanitization of hard drives requires special software and procedures. The NSA keeps a list of approved products for this use. Physical access to PHI is a very common source of information loss. A Boston hospital was fined $1 million after an employee left a stack of medical records on a train. Furniture must be arranged to make it impossible for persons in walkways to read data on computer screens. HIPAA requires all PHI to be protected from loss, theft, corruption, or destruction. Security alerts should be provided to all associates on a weekly basis. Information security requires constant vigilance. Testing is the last part of this security awareness training program. Credentials to access the test site will come from your designated testing manager. Go to the web page designated by your testing manager. Click on the line Exam Participants, click here. Enter the username and password you received from your testing manager. Use your mouse to select answers on the multiple choice test. After completing the exam, you will receive a certificate of completion showing that you have met the annual HIPAA Security Awareness Training requirement. For more information, contact your testing manager or one of the individuals shown on this slide. Thank you for taking our training.